All right, it is very nearly 5 minutes past the hour, so let's kick things off. And I'd like to start off with just saying good afternoon and thank you very much to those of you who are here today. I really appreciate your attendance and I hope that this is an insightful and exciting session for you. Today, we are going to be discussing one of the latest releases by Primal Pictures, which is really here to make the educator's job easier, and that is the anatomy learning outcomes for medicine. Before we dive into the session, if you haven't met me before, my name is Stephanie, and I'm one of the anatomists from Learning Curve. And we at Learning Curve are the very proud African and Australian providers and partners for Primal Pictures. A bit of an agenda of what we'll go through today. And actually, before I start that, I would just like to apologize that I have you all muted and your cameras off. I don't want that to be a barrier between us. It's just how we run these webinars to make sure things run smoothly. But if you have any questions or comments throughout the session, please pop them in the chat box. I'd love to hear from you, and we will have a Q&A session at the end. So I'll start off with giving the origin story of this new content that was created, as in why it was created. Then we'll discuss the partnership that was formed to create this wonderful content and review the importance of having learning outcomes in education. Then I'll take you through the journey and the goal of creating this new content and discuss what was created. And then we will jump into it and take a look at what this new outcome-based content looks like. And then after that, I would like to discuss principles of flipping the classroom and how this wonderful content can be used in a flipped classroom model to maximize your time with your students. I know some of you here may have attended our workshop at the ISMS conference very recently, but if you did hear about this new product then, the session is still going to be helpful to you because we're going to go into quite a lot more detail about the academic background of this content and dive more into what the content looks like and how it can be used. Okay, but I keep alluding to the content and we don't know what the content is yet. So let's start off with the origin story. Anatomy is a wonderful subject, and I think I'm preaching to the converted over here, but unfortunately the students don't always feel that way because it can be very overwhelming and complicated to someone who is new to learning anatomy. And unfortunately, we are also seeing a worldwide trend of teaching time for the anatomy syllabus being reduced. Primal Pictures has its wonderful 3D models and a whole host of educational content on their platform, but it can be quite overwhelming sometimes, especially when students are new to the environment. So we want to help you help your students understand exactly what they need to know and guide them through that learning process. So Primal Pictures very proudly partnered with the Anatomical Society of the UK and Ireland to create the content that we're going to discuss today. The Society published in the Journal of Anatomy 156 anatomy learning outcomes for the undergraduate medical curriculum. This curriculum has gone through a few different versions, and this latest edition was put together through a Delphi process. And if you would like access to this journal article, please do let me know and I will happily share the link with you. But at the end of the day, the Society published these outcomes to make it incredibly clear to both the students and the educators what anatomy needs to be known and what needs to be taught. And it breaks it down into very lovely bite-sized pieces to make it a lot less overwhelming. So why are learning outcomes important in education? Number one, it gives a set of topics which provides a common and clear understanding. So it does make it very clear what needs to be taught and what needs to be known by the students when they are preparing for their assignments. And it also provides a measurable way of setting specific goals and assessing the understanding of particular topics. Now, anatomy is incredibly important and underpins all medical training, and it is quite extensive for students. So that's why the Society created that core curriculum. And that curriculum was created by anatomists, surgeons, and doctors. At the end of the day, it was put together by experts in the field. So Primal licensed these outcomes and partnered with the society to create an editorial board. And this consisted of nearly 50 educators from 33 different institutions around the world. So this was a very collaborative and international project, which does include 2 South African contributors who we are very proud to see representing our country in this wonderful world-class tool. And they created content to cater to a variety of learning styles to help keep the students engaged and to help them learn each of these 156 outcomes. So each topic is presented by a different educator who is an expert in that specific field of anatomy. And every single word spoken in this content, and we quite literally mean every single word, has been verified for accuracy and relevance to the medical curriculum by industry experts. And we are very thankful for the international team that collaborated to make this possible. So what was created? What can we find for each of these outcomes? For each outcome, there is a short explanatory video which will explain everything that the student needs to know in that specific learning outcome. And after that, there will be interactive 3D models, dissection content, and some clinical application to help the students further their understanding of that outcome. And then in the next release of this product, there will also be the addition of quizzes to test the students' understanding of that outcome. So that isn't released yet, but I will show you what is currently available and re-allude to what you will see in the future when the final version of this product is available. Primal's goal in creating this content was to really simplify things for the students and alleviate that overwhelming burden and have clarity with what they need to know so that the overload that sits on these students' shoulders is reduced and we can increase engagement and confidence in the students. Now, I also want to very much emphasize that before we look at this content, please bear in mind that this was not created with the goal of undermining or reducing the importance of the educator, because the educator and contact teaching time is still so vitally important. But what's wonderful about this content is that it's a perfect preparation tool for your students to use before they come to your classes, so that they have heard a concept for the first time before they are with you, so that they can learn on a deeper level while you explain the information to them. And secondly, it is a wonderful preparation and revision tool when they are revising and preparing for an upcoming assessment. Okay, but without further ado, let's jump into Primal Pictures and let's take a look at this content. And once we are finished exploring the content, we will discuss how it specifically can be used in a flipped classroom model. Okay, so here we are on the homepage of Primal Pictures, and you will see that the learning outcomes for medicine is the first title I have available to me. And the wonderful outcome-based content can be found either by clicking here on the medicine block or going to the Learn tab, which is a new addition for Primal. I would like you to bear in mind that Primal is continually developing and furthering their content. Currently, this is outcome-based educational content based on the medical anatomy curriculum. In the future, Primal Pictures will be looking at taking these same curricula that are published by the society, but tailored to different health science professions. So they have outcomes for nursing, physiotherapy, dentistry, and some other professions. And Primal will be looking at using their outcomes for each of those professions to be creating similar content. However, this content developed for the medical curriculum is certainly still applicable across other health science disciplines, but you may just need to pick and choose and dilute which ones you ask your students to look at, because the medical curriculum may be a little bit too detailed or too comprehensive for them. Okay, but here we are in my Learn tab, and you will see I firstly am introduced into where the content comes from. And here we have a link to the journal article where the Society published these 156 learning outcomes. You will see that the outcome-based content has been broken down into different regions of the human body. So as we scroll through the outcomes, you will see the topic and you will get information about the presenter for that specific topic. And you may also notice that we can see how I've been progressing through these learning outcomes. Some I have started but have not finished, and that's why they say continue. Some I have completed and I have the option to revisit, whilst others I haven't started yet. Okay, these all say continue, but let's jump down to ones that I haven't started. And here you can see that I can identify that I haven't started these ones yet. But for today's example, I am going to stick with one of my favorites, which is the cardiovascular system, and naturally would be found in the thorax with relation to the anatomy of the heart. And when I scroll through these learning outcomes, I will come across the one that is particularly important to me and what I will show you today. And I actually have that one preloaded over here, which is learning outcome 61. So once you click on any of these outcomes, you will then be presented with all of the information for that outcome. So firstly, this outcome will cover the origin, course, and main branches of the left and right coronary arteries and discuss the functional consequence of their obstruction in conditions such as ischemic heart disease. The first thing we are presented with is a short explanatory video, which will give an explanation for everything covered in this outcome. Now, I am going to mute it because I don't think we need a lesson today. We would just like to get an understanding of what sort of content we can find here and how it can be used for the educators and students. So I'm going to scroll along in the video to where Angelique starts discussing the left coronary artery. And we have this option to make Angelique and her video a little bit smaller. And if I scroll down, here I have the 3D real-time views that Angelique is using in her explanatory video to cover this outcome. And as Angelique explores the different branches and the origins of the various coronary arteries, we can follow along with her by using this content and the pinned icons. Now, at any moment, you can do whatever you please with this 3D model while you follow along with Angelique, because we have the full 3D real-time functionality embedded here. So I may want to change my 3D model to cadaver colors so that I can think more critically about the difference between an artery, vein, and nerve. And again, while Angelique goes through the different origins and branches, we can follow along with her. Okay, so I think that gives you a good idea of what these explanatory videos look like and how the students can further engage with the 3D anatomy and follow along with the educator with the 3D real-time 3D models. Now, after this virtual dissection information, we have some additional content. And this is where you will find different images or 3D models or dissection images that relate to this outcome. So what I'm busy loading over here is just a standard labeled image of our heart and the major vessels. And then after that, we will find clinical content that relates to this outcome. Now, naturally, what relates to this outcome includes both myocardial infarction and sclerosis. And if you are familiar with the diseases and conditions title, you may recognize these videos. I have put it on mute here, but here we have a short but comprehensive video available for both of these diseases, where it will give you all of that important context and go through the affected anatomy, as well as the symptoms, diagnosis, and treatment for each of them. Now, if I, as a student, am finished with this, I could scroll down, click complete, and then move on to the next outcome. I mentioned earlier that this is not the full release of this title, and there are still additions to come. So currently we have wonderful educational and guided learning content here, but we don't have any testing content. And in the next release, there will be multiple choice quizzes placed at the end of the outcome, which will allow the students to test their understanding. What is also to come in the future is the ability for educators to have visibility over their students' progression through the outcomes. So you will be able to see which outcomes your students have completed, and you will be able to track the results of the quizzes that will be embedded at the bottom of each outcome. Okay, but now I have completed my outcome and I am ready to move on to the next one. And this outcome over here, presented by Rebecca, is going to go over the major anatomical features of the chambers of each of the hearts. Each of the chambers of the heart, excuse me, I would hope we only have one heart. But what I would like to show you here is one thing we didn't see in the previous outcome, and that includes the dissection content. So here we have some wonderful dissections showing key features of the gross anatomy of the heart. And it allows us to visualize the different chambers of the heart in an image that gives a realistic representation of cadaveric or patient anatomy. Okay, but that brings me to the end of my demonstration of what this outcome-based content looks like. The summary of it is that it is guided, outcome-based information that is trying to alleviate some of the overwhelming nature that comes along with anatomy as a subject for health science students. And again, this has been created for the undergraduate medical anatomy curriculum, but it certainly can be used across other health science disciplines. So now that you know what this content looks like, I want to discuss a way in which it can be used in a flipped classroom model. So let's come back to my slideshow and let's briefly discuss the flipped classroom model. This educational model allows students to encounter information for the first time before class or contact time. The teaching or contact time is then used for activities which involve higher order thinking. And this allows for students to, number one, collaborate with each other, and number two, to have active learning experiences. And it also allows students to take learning at their own pace. So if they encounter and work through the information before contact time, they can do that at their own pace, and then they can use the precious contact teaching time for collaboration and deeper thinking. Now, when you are wanting to implement a flipped classroom model into education, there are three things that need to be done. Number one, you need to decide how class time will be used and design activities that will encourage student collaboration and higher order thinking skills. The next thing you need to do is find or create resources that students can use at home. And then number three, teach students how to use the material at home. Now we, as providers of Learning Curve and providers of Primal pictures and supporters of it, we can do number 2 and 3 for you. We have the resource, which is the Anatomy Learning Outcomes for Medicine, and we provide our clients with training, and this includes both staff and student training. Meaning, if you were to use this resource, we will give your students training on how they use this material at home to guide their own learning and work through it at their own pace. And then all you would need to do is create those activities and decide how you will use your class time to get your students to collaborate and switch on those higher order thinking skills. This does require quite a lot of preparation and effort on the educator's behalf because it is changing your approach and your strategies towards teaching your students. But this content can be integrated into your current educational strategies by simply using it as a preparation and a revision tool for your students, and perhaps even to give yourself some inspiration on how you would like to tackle different learning objectives in the anatomy curriculum. Okay, but that brings me to the end of my presentation and demonstration. So the final thing I would like to say is that all institutions are eligible for a 30-day trial of this platform where you as educators can explore it and assess if you think it meets the needs of your students. And number two, all students can also access it. And I would very much recommend for that so that you can get feedback from your students on their experiences. If you would like to arrange a trial, please don't hesitate to contact me. And if you would like to stay abreast of our monthly webinars, please do follow us on Instagram. Our handle is anatomy_sucks. And on Instagram, we do post our monthly webinars as well as the registration links.